City. You're watching the CW11 Morning News.
Welcome back. Well, each week in Ask the Doctor, I answer your health and medical questions. But today, it's all about your dental questions. So we decided to bring in Dr. Paul Tanners. He's a dentist, and he's going to answer them for you. Dr. Tanners, thanks for coming this morning.
Well, thank you for having me.
All right, we got a bunch of questions, so let's get right to them. We're going to get to our first email. I'm going to pop it up on the screen. Here it is. Okay, when I brush my teeth, my gums sometimes bleed. That's from Brendan in Long Island. Why does that happen?
Well, if it's occasional bleeding, it's not a terrible problem, but it does occur because the tissue is inflamed. As you know, inflamed tissue is never a healthy state.
Right.
Bleeding gums can be indicative of other medical conditions. Some of those conditions are diabetes, leukemia, vitamin deficiency. Also, we have found there's a correlation between bleeding gums and such diseases as pancreatic cancer, heart disease, stroke, etc. The only time it's relatively normal for gums to bleed is when you're changing toothbrushes from a worn-out old toothbrush, which isn't getting into the sulcus around the teeth, to a new toothbrush, which is.
All right, so
yeah.
you want to be aware of that, but try and keep them healthy all the way through. But if you are having problems, talk to your dentist because it could be something else.
Exactly, get to your dentist because only he can really diagnose the situation for you.
Perfect. Okay, let's get to another email. We have a second email. Here it is. My fillings, are falling out. How long are they expected to last? That's from Dana in Clifton, New Jersey. A lot of people have a lot of old fillings, right?
Yeah, well, that's a kind of a no-no. Fillings shouldn't be falling out. If a filling falls out, as far as I'm concerned, by definition, it shouldn't be in the mouth in the first place.
Okay.
And there are many different kinds of fillings. There are fillings, silver fillings, tooth color fillings, crowns, onlays, inlays.
Right.
If you're having a routine problem with fillings coming out, and you have to go back to the dentist all the time to replace something, I would speak to your dentist and find out why that's happening so frequently. And if he can't give you a satisfactory answer, perhaps get a second opinion.
There you go. Okay, thanks. Let's go to outside. We have a question from outside. Here we go.
Hi, my name is Tatiana. I live in Manhattan. I don't really believe in flossing. Is it really that necessary? Can you please answer me this question? Thank you.
Well, I couldn't live without flossing. How do you do that?
Tatiana, I think you better start believing in flossing.
Right.
Because flossing is very, very important. Just as the toothbrush is used to mechanically remove the plaque from the top and sides of the teeth, the floss removes the plaque from between the teeth.
Okay.
What we call the interproximal space, and that's where most cavities start.
So she's got to floss.
She's got to floss at least once a day.
All right, Dr. Tanners, thanks so much for coming. And if you have a question for Ask the Doctor, go to our website, cw11.com/morning news, and he'll answer your dental questions there.